It's a breakthrough in cancer treatment, and UChicago Medicine is one of the first hospitals to offer it. Our Joe Donlan found out it could turn into an entirely new way to fight the disease.
Ala Pinsour has been fighting skin cancer for around 15 years, but not anymore.
I am cancer-free, not even in remission, so cancer-free.
She was first diagnosed in 2009, but after years of surgery and treatment, the cancer started spreading to other organs.
It kept coming back every 6-7 months.
So her doctor signed her up for a new kind of treatment. It uses the patient's own tumor-fighting T cells, called tumor-infiltrating lymphocytes, or TILs.
By taking those TILs out of the patient and then expanding them and activating them in the lab, we go from maybe millions of T cells that we find in the tumor and expanding it to billions of T cells, and then we infuse that back into the patient.
Dr. Daniel Olson is an oncologist and researcher at UChicago Medicine.
Most of the complex biology of this process is already happening from the patient's immune system, and so we're taking advantage of something that happens for reasons that we understand to some extent, but for also reasons that we probably don't understand fully. And we're leveraging that to create a therapy.
First, there is a surgical procedure.
UChicago Medicine gave us these graphics to show you the 5-step process. Doctors remove a piece of the tumor and extract some of those TIL cells. Then they have them boosted at a lab, give the patient chemotherapy, and put the TIL cells back in the patient where they fight the tumor. Afterward, the patient can recover.
Having a therapy like this is wonderful. I mean, personally, it feels great to be able to offer patients a chance at cure, a chance at long-term remission.
The concept has been around for decades, but the actual treatment was just approved last year. UChicago Medicine says it's the first to offer this treatment in the Midwest.
To be able to have this is, amazing, but it's also what we think is just the start.
Dr. Olson is hoping it's the first step in a whole new way of treating cancers like the one that was threatening Pinsour's life.
I'll be able to probably see my daughter getting married, my son graduating from medical school. I did not know if I'm going to be able to see any of those things. It's a miracle. I call this miracle.
Dr. Olson says that researchers are already working on ways to use this kind of treatment to fight other types of cancer like lung, cervical, colon, and breast cancers.